Hello, everyone. Good morning. I'm Christian Hausner from Value Innovations Research at Henry Ford, under the guidance of Dr. Charles Day, and I'm here today to present about carpal tunnel release. Carpal tunnel release is one of the most common and effective orthopedics procedures, with extensive research dedicated to maximizing functional and patient-reported outcomes. Yet, there's a need to establish reliable early indicators of long-term recovery and patient satisfaction as part of our shift towards value-based care. Since patient satisfaction is influenced by subjective perceptions of improvement, it is challenging to benchmark recovery at early time points. But minimum clinically important differences, or MCIDs, in patient-reported outcomes metrics present a standardized approach to assess patient recovery and also have been well established for carpal tunnel release. Yet, MCID is not routinely used as a clinical tool to adjust treatment plans beginning at the first postoperative visit. To address this gap, our study aimed to explore whether achieving MCID early on could serve as a reliable predictor of long-term recovery and quality improvement in CTR patients. We conducted this study as a longitudinal two-cohort comparison of open and endoscopic carpal tunnel release to provide new insights into procedural effectiveness from the patient's perspective. We performed a retrospective chart review of 146 patients who underwent either open or endoscopic carpal tunnel release by two hand surgeons at our institution between September of 2020 and February 2022. We collected PROMIS scores at baseline, which were our patient-reported outcome metric, and then again at 2, 8, and 16 weeks postoperatively. We also collected information on patient demographics, comorbidities, and preoperative history. And notably, there was over 70% data completion at all follow-up time points. And now here's what we found. First, in the figure on the left, in the context of our surgical technique comparison, endoscopic carpal tunnel release was associated with an improved level of early recovery. At the 2-week mark, significantly more ECTR patients achieved MCID in both upper extremity function and pain interference, which were our two PROMIS metrics. This translated into a higher self-reported satisfaction in the ECTR group and significantly improved PROMIS scores. Again, at 8 weeks, a higher proportion of ECTR patients achieved MCID in upper extremity function. But by 16 weeks, both groups had similar proportions of patients who reached MCID, though ECTR resulted in significantly improved PROMIS scores still at this time point. So, while endoscopic release leads to improved early recovery trajectories, both techniques are about equally effective by 4 months postoperatively. Additionally, we found that achieving MCID at 2 or 8 weeks predicted better PROMIS outcomes at 16 weeks, independent of surgical technique and baseline characteristics. In fact, 2-week and 8-week MCID achievement were the strongest predictors of 16-week PROMIS outcomes in our regression model, with an adjusted fit of 0.47. Notably, more predictive than a host of patient demographic and health information that is routinely collected prior to surgery. We also uncovered several interesting subgroup findings in early postoperative outcomes, notably that procedure type did influence patient-reported outcomes at 2 weeks. Also, patients with shorter symptom duration of less than a year tended to report more pain relief, as did female patients. And together, these findings suggest that individual patient-level factors play a significant role in shaping recovery trajectories beyond just the choice of surgical technique. So what could this all mean for clinical practice? First, early follow-up at 2 or 8 weeks may offer valuable insights into how a patient is trending towards recovery. If they haven't reached MCID by then, it might be time to consider earlier intervention, whether that's additional therapy, follow-up, or expectation management. Second, endoscopic carpal tunnel release appears to offer faster early functional and pain improvements, which may coincide with earlier return to work, less reliance on pain medication, and improved satisfaction. And finally, incorporating MCID tracking into routine postoperative care could help physicians deliver more personalized, patient-centered care, and possibly improve long-term satisfaction and outcomes in an effort of quality improvement with carpal tunnel release. In conclusion, our study highlights the importance of tracking early MCID achievement as a meaningful predictor of recovery after carpal tunnel release. And while outcomes may be similar between the techniques we have examined, early improvements, especially within the first 2 weeks, can tell us a lot about how a patient will do over time. We hope to expand upon these findings with future prospective cohort trials using MCID as a clinical pathway checkpoint in CTR recovery. Thank you very much for your time, and we hope you enjoyed our presentation today.